right, welcome back, everybody. I'm Mark Morrison, the San Diego City Firefighters Local 145, for our live streaming session and day 12 of our campaign to give back to all of our San Diegans who are struggling during this COVID-19 crisis and getting them the resources that they need. We have two very special guests with us today. We have Verna Griffin-Tabor of the Center for Community Solutions, as well as Council Member Dr. Jen Campbell. I would like to first talk about the Center for Community Solutions. Last year, this incredible organization positively affected over 17,000 adults and children. They do incredible work, and I'd like to welcome Verna to our program. Verna, welcome.
Thank you, Mark. And thank you to the firefighters. What a tremendous gift this was. So thank you so much. And thank you for your service as well.
Oh, the pleasure's all ours. It was great meeting you in person yesterday. As difficult as it was to not observe the normal greetings of a handshake or a hug, but of course we have to do what we have to do during this time. Verna, it would be really great if you can talk to the folks who are joining us today about what kind of incredible work that your organization does and a little bit about what your mission is in the community.
Absolutely, Mark. And it truly was a challenge, not just with the generosity that you were presenting to us yesterday. Everything in me wanted to at least shake your hand or give you a hug, but we're honoring social distancing. So thank you for acknowledging that. Center for Community Solutions, we've been around for 51 years. Our mission is to end relationship and sexual violence by being a catalyst for caring communities and social justice. And we do this as the only rape crisis center for the city of San Diego. And we also work for the prevention and healing of sexual and intimate partner violence. And prevention is an equal part of what we do. So in the county, we're in 10 different locations. We're on college campuses. We have 3 emergency shelters, 3 business offices. And our commitment to sexual assault survivors is to respond within 20 to 30 minutes to the hospital once law enforcement has taken them to the hospital, to be by their side as they go through the evidentiary, and then by their side through whatever supports they may need, whether it's counseling, housing, food, legal services, we're by their side. The same thing we do is for domestic violence. We have shelters, legal services, therapists, attorneys on staff to work with them. One of the number one requested service for victims of domestic violence are legal services, and we have 8 attorneys on staff with advocates and volunteers trying to meet that need. With COVID-19, there's been some special challenges, which I know that's what all of you were so gracious to help us try to meet the special need. We're really concerned about those folks who are asked to shelter in place with someone who is harming, and also children who are witnessing. So we've gotten really busy about in less than 24 hours trying to mobilize our workforce to do video conferencing, teleconferencing, messaging to the public on how to safely reach out for help to our hotline 24 hours a day. Our shelters remain open, but we had to do some adaptations to make it so that we could do containment. And when I say that, what I really mean is we had to bring in refrigerators and microwaves to some of the separate units on shelters that had communal kitchens. So we've been trying really hard to get to our community, to let them know help's available while we try to meet the need for the survivors coming forward.
It's a really important thing that your organization does, and it's such a sad and tragic thing to have to deal with as well, especially in these times. To kind of tie in what you're saying about the crises that your folks deal with when there isn't a pandemic going on, what kind of challenges are you looking at as far as the uptick in domestic violence or sexual violence, and especially trying to raise the resources you need when everybody's locked down and money's really tight? How maybe can you relay to the people that are watching how they can help out as well?
Absolutely. We had to cancel, and rightfully so. It's not safe to do any of our events, and we depend on our annual events for our revenue. In addition, there's been expense to try to get a workforce in 10 locations working remotely when they were not. We've also had increase in one of our shelters. It's a long-term shelter for people who are really rebuilding their lives, getting on their feet. But in many of those folks were having entry-level positions. They were buying their own food. They were traveling with public transportation. Unfortunately, 99% of those folks have lost their jobs for now. And so we're back to trying to provide the food and the support and transportation that they at one time did themselves. The other part is we're trying to work remotely with the courts, which judges are seeing temporary restraining order cases. So we're trying to get as flexible and amenable to meet the community, and also asking the community for financial support. The community's also pulled together. We didn't have enough masks for all of our clients and our staff. We've had people hand making masks. We've had people offering to drop off food and supplies. We're still struggling, believe it or not, to get enough thermometers for all of our locations. That's something we definitely need. Normally, we have a workforce of over 300 volunteers, but for the time being, because of the containment, we're not able to have our volunteers come in and out of the shelter or answering hotlines. But when this passes, we'll be back asking for help because we can't do this work without all the volunteers. And this will pass. I have to tell you, as intense as these subjects are, every single day we see courageous people overcoming these challenges and then becoming part of the workforce with us to help others heal. So there's every reason to be hopeful. We just want to find creative ways to get to people who need us in these circumstances.
Yeah, absolutely. I guess there is the potential silver lining of the heightened awareness that this brings. Perhaps we'll get more resources to you. I mean, just getting to meet you and work with your organization. I'm sure San Diego City Firefighters at some point would love, when this is all said and done, to sit down with all the folks that we got together with over the course of this campaign and really find out how we can dig our heels in and make some positive, effective changes. Especially in a time like this where people really need each other more than ever. It's just so tragic and horrible to think that there are people who are having to shelter in place in these terrible situations.
Absolutely.
But that's why the work you do is so important. So with that, I'd like to pivot over and welcome Councilmember Dr. Jennifer Campbell. Welcome, Councilmember. How are you?
Thank you. I'm well. Thank you.
Yeah, welcome back. Thanks for sitting down with us again. It's a real treat to have the ability to chat with you. And well, let's just get to it. Why did you select the Center for Community Solutions and the work that they do, and how did you find out about them and get to work with them?
Well, for over 50 years, they've been working here in San Diego. They are our San Diego rape crisis providers of services, and they do so many other things as well. But they're just fantastic, the good that they do in the community. And they help everyone. They don't care if you're male or female, a grown-up or a child, LGBTQ. It doesn't matter. They're happy to help anyone who's in a situation of partner violence. And it's a wonderful thing that they do. And their headquarters are located here in District 2. And so we know about them. And also my chief of staff has been a champion of theirs for a long time. And they're just a wonderful organization. And I figured that in this time of need, they would be one of our main choices to receive your wonderful, generous donation. So nice of you firefighters. You guys are great.
Again, it is our pleasure. This has been a real treat to meet a lot of the figureheads and the folks making all of these. They call us the front lines personnel, but it's safe to say that there's a lot of other people who are on the front lines that maybe don't get the recognition that they truly deserve, much like these organizations. And it's really our pleasure to help them out. So I got a follow-up question for you, Dr. Campbell. With your extensive background in the medical field, a lot of folks are under the impression that we're in the fourth quarter, final stretch of this thing. Is there anything that you can maybe talk about with the COVID situation, especially with the importance of sheltering in place and getting the resources to places like the Center for Community Solutions, where it is a necessary thing to shelter in place? However, we need to get the resources available for folks who may be sheltering with some really bad situations going on. Is there anything you'd like to speak to that whole dynamic?
Oh, I think it's, this is so new and different for us. This is the worst virus ever. This is the worst germ of all the kinds of germs that I've ever known about. I practiced medicine for 40 years, and I've never seen anything like this. Mostly the problem is it's so darn contagious. You can be infected with it, not even know you have it. You cannot have symptoms it ranges from 2 to 14 days before you get sick. And now we're beginning to find there might be some people who never even get symptoms from it, but have it. And once you have the live virus, you can easily spread it. It's more easily spread than anything I've ever seen. It's airborne, it's droplet. So it's in little vesicles of saliva, of sweat. If we just speak to someone up close and we happen to have it and don't know we have it, we can give it to them just talking to them. So that's why wearing masks are so important. We have studies now that show us, we didn't know in the United States that not only does it protect us from giving it to someone else, but it protects us from getting it. So it's very important to wear your mask whenever you leave home. Be sure and wear your mask. And it's important to leave home. We're allowed, if you're healthy, no fever, you're allowed to go outside, walk around, maybe jog if you like to jog, ride your bike, and stay safe, but don't congregate. Stay far away. We have dogs. We walk the dogs every day. We see the neighbors and we talk to each other across the street. Kind of hard on the strain the voice, sometimes you have to yell. But it's really nice to see other people and at least be able to wave and say, hi, how are you feeling? But it's really intense when it comes. We have one family member who got it. He's an RN, a nurse, and works at a hospital. We're not sure where he got it because no one in his particular hospital has had it. But we think he got it out shopping. And he's a really strong guy. He's a bodybuilder. He's kind of like you firemen, he's in really good shape. He believes in eating healthy.
Some of us firefighters, some of us.
No smoking, no alcohol. He's really a clean living guy. And so he's so strong. And this thing just knocked him over. All of a sudden he got a fever and he was knocked out. And it took 3 weeks before he could go back to work. Luckily, he didn't have to go to the hospital. But I think a lot of it is because he was so fit and so young. He's only about 40. So he was able to stave it off. And thank God. So now he's back at work helping others, which is his favorite thing to do. And God bless him. Thank God he got well. But it's really a terrible thing. And we haven't seen him, in about 2 months. He lives a block away and he's afraid to come visit us. We've been quarantined for almost 6 weeks now, except for getting out to take walks. And he doesn't, because he does go out to work now, he doesn't want to come over and possibly expose us to anything he might have picked up during the day. So it's just, it's so sad. We have 2 of our children who live on the same block and we all distance.
Yeah.
Really sad. We do FaceTime.
That's good. That is good.
Yeah.
Well, you have one of the more beautiful districts also, so trying to keep people indoors would probably be a challenge in and of itself, council member. Especially I know that the Morrison household has been kind of flirting with the idea of going into the haircut business. But last time we did that, I ended up with a shaved head. So I guess we're going to have to wait for those haircut places to open up. But no, that's a great message, council member, just to kind of stay the course and do what we have to so we can all get through this together. And again, it all kind of points back to all of these organizations doing such a great thing to kind of keep everybody going. And Center for Community Solutions, your mission is pure and true, and it's an important one. So I'd like to kind of throw it back to you, Verna, if you wouldn't mind. Anybody that's watching, folks that have the ability and the means to help you out, to help fellow San Diegans out who are really facing 2 crises at once, which is just a terrible thought. I mean, we're going through this pandemic that we've never seen before, and for a lot of folks, that's a secondary thing. So can you chat about how we can get the resources to them and how folks who are watching can help out?
Absolutely. So a couple ways. Number one, if you or somebody you know or a family member you're concerned about, you can, number one, call our hotline 24 hours a day, 7 days a week. No one is going to talk you into or out of anything. They're going to tell you what resources we have. If you're a family member and you're concerned that you know somebody's being harmed, our hotline is 888-DV-LINKS or 888-385-4657. And also you can go to our website if you want to see the work we're doing, you want to know how to help. If people have the wherewithal and want to get involved, they can reach out and call us either on the hotline or at our reach out on our website. We also need the financial resources because to meet the current need and the creative ways we're trying to do it, we need the help. But please, if you know of anybody who needs help, the thing we would suggest to anybody is just be a good friend. You do not want to talk somebody into or out of leaving or staying. Let them know help's available. Sometimes the most dangerous time can be when somebody's leaving, somebody is harming them. So we want somebody to have a safety plan and be able to know that they have a safe place to go to. So again, we have a hotline, our website. And thank you to both you, Dr. Campbell, and the firefighters. Please extend our gratitude. It matters. You're really helping us help others. And thank you both and all the firefighters for your service in our community.
Thank you for that. It's pretty much everybody that goes into the fire service has a profound desire to help. And our Community Responsibility Fund is a fund that we've all created by donating a portion of our paychecks to causes like yours, because again, we are helpers. That's what we want to do. And the fact that we have that and we're getting it to you, it makes us all feel good. I can say on behalf of the executive board, as well as our entire membership and all the firefighters in San Diego, the honor is ours to be able to help an organization like yours. And we really appreciate it. Thank you very much. And Councilmember Campbell, if you'd like to add anything else, please.
I just want to say how wonderful this organization is. And once we get over this pandemic, they provide programs in schools and colleges and to community groups. So if you have a community group that wants to learn about this, they would be an excellent reference to get in to talk with your group and to help you to do, maybe you can help them to do good in the neighborhood. They're all over the place.
Very good. Well, thank you both so much. We really appreciate you carving out some time to sit with us and bring awareness to an incredible cause and to help us in our mission, in our campaign, to get the resources to the San Diegans who really do need it the most. And just with that being said, everybody who's watching, we just want to remind you that hope is alive and well. This is a terrible time, but we're going to get through this together. And don't forget, San Diego City Firefighters will always be here when you call. We're here for you, and we're going to continue doing what we're doing, and we're going to continue providing the highest level of service and continue to help the community. So thank you both for joining us. Thank everybody else who joined us in this live stream. Join us tomorrow for day number 13 of our campaign, and we'll see you then. Thank you all so much.
Thank you.
Really my honor.